Most people think recovery looks like this, the ice pack, but really it's about this, being able to raise the mug. Getting back to the simple things that make life feel normal again. That's what recovery is about. Hey there, I'm Dr. Daniel Orcutt, retired orthopedic surgeon who's helped over 1,000 people recover from shoulder injury and shoulder surgery. If you're dealing with pain, prepping for surgery, or recovering, I'll break it down so it all makes sense. Real answers to help you heal smarter. So let's get into it. Let's start with the big question. Every patient used to ask me, how long is this going to take? Well, the truth is recovery doesn't care about the calendar. It's not neat, it's not predictable, and it doesn't flip forward as easy as turning a page on the wall calendar. Honestly, it's more like waiting at the DMV. You think you're next, you're waiting, and suddenly you're stuck, you're not moving, you're in the same chair for another 45 minutes. So if it's not about counting weeks, what is it about? So in the beginning, recovery is usually measured by two things, pain and sleep. I'll never forget a patient, Susan, who came 3 weeks after a rotator cuff repair. And she said, Doc, the pain is not terrible anymore, but I feel like I'm losing my mind because, I haven't had a full night's sleep in weeks. That's the reality for so many people. Pain starts to ease, but stiffness sneaks in. It's like whack-a-mole. One thing happens and then another thing pops up. And if you've been there, 3 straight hours of sleep feels like winning the lottery. It's amazing. What is the first milestone you're looking forward to? Is it sleeping, driving, reaching overhead? Drop it in the comments below. I'd love to know where you're at. I'd love to know what you're really looking forward to. But here's where it gets encouraging. Once the pain calms down and you can finally rest a little, the measuring stick changes, right? Suddenly, recovery is not judged by that. It's judged by what you can actually do in your daily life. So Mary, one of my patients, told me the first time she reached for the seat belt without twisting her body, she felt like she conquered this goal of hers. Others being able to drink out of coffee without wincing, or finally putting on a pullover shirt without a fight. These small daily victories are real events worth celebrating. Of course, being able to do something once isn't the whole story. The real question is, can you do it without paying for it the next day? That's where we talk about capacity, where capacity comes in. I'll tell patients to think about red, yellow, and green zone. Green means you're fine doing it. Yellow means proceed with caution. And red means you push too far. So let's talk about Mike, another patient. After about 6 weeks, he realized he could finally reach overhead again. Big win. So what did he do? He decided to clean out the garage. 3 hours later, his shoulders was hurting a lot. And for the next 2 days, he was stiff, sore, and worried he messed everything up. Now, here's the important lesson. Just because you can do something or do something once doesn't mean you can do it for hours on end. We have the capacity that builds slowly. So think of it like walking after being stuck in bed. You don't go straight to the marathon. You start with a few steps. You recover, you build from there. So when it comes to recovery, don't measure success in a single victory. Measure it by what you can repeat tomorrow and the next day without setting yourself back. That's what real progress looks like. So that's important for us. Otherwise, you're just volunteering for a front row seat in the red zone, and no one wants to be there. By the way, I put together a free shoulder pre-op checklist. It's built from the lessons that I've used helping people over the years. So if you don't have it, put a comment in the link below and we'll send it to you. One of the biggest frustrations I see is when recovery doesn't feel like what people expected, right? They think they'll notice progress every single day, straight line up. But in reality, recovery feels more like the stock market chart, right? Up one day, down one day, sideways sometimes. And that doesn't mean you're failing. It just means that your body's healing in a way that is designed to heal. Progress is often hidden in reduced inflammation, in tissue remodeling, in the nervous system calming down. So just because you don't see it on the outside doesn't mean it isn't happening on the inside. So when you hit those flat weeks or even a small setback, remember those dips are baked into the process. Stick with the plan, listen to your body, and don't let one bad day convince you that the whole thing is off track, right? If recovery were predictable, I'd be handing out stopwatches, not ice packs. Here's something a lot of surgeons and therapists don't talk about: the emotional side of recovery. It's normal to feel discouraged, to wonder if you're doing enough, or even to worry, have you made a mistake of having surgery? I've heard it all from patients over the years. But here's the truth: those feelings don't mean you're failing, it means you're human. So every milestone, whether you're sleeping better or putting on a shirt or buckling the seatbelt, is not just a physical win, it is truly a mental and an emotional one too. That's why we should celebrate those small victories. It's important. They remind you that you're moving forward, even when progress feels slow. Recovery isn't just about the shoulder, it's about your confidence, your peace of mind, and getting your life back. So yes, keep working on the exercises, but don't forget to give yourself some credit for those hard days you've been through, because that's where resilience is built. As you move further along, recovery takes on another meaning. Now it's about independence, sleeping without the sling, sleeping without a pillow, cooking your own meals, and driving again, which feels less like freedom. It feels like more that you're off house arrest. So John, a shoulder replacement patient of mine, told me the moment he got cleared to drive was the first time he felt like himself again. He said it wasn't about the car. It was about not needing my daughter to drive me to every single appointment, to the grocery store, to even me, the gym. That independence is a huge marker of recovery. And there's one more piece people often overlook: who is guiding you through the recovery? Because the truth is, a good physical therapist can completely change the way this process feels. A good PT personalizes your plan, listens to your feedback, and adjusts things when something's not working. A bad one hands you a generic sheet that looks like it was faxed in 1993, and you deserve better than that. So when someone asks me, it's never just about one thing. It's not only about pain. It's not only about function. It's not only about independence. It's like a mosaic, all these little pieces that fit together. What does good recovery really look like? And at the end of the day, it's not the calendar that matters. It's the moments. It's the sipping the coffee while thinking about your shoulder. And it's about holding the coffee mug and doing that without worrying. So I hope this is helpful. Hit the like button, the subscribe button, and don't miss the next video. And don't forget to grab your free shoulder pre-op checklist. It's built from the lessons from helping over 1,000 people through shoulder injury and shoulder surgery. Click the link below to grab it. And if you want to track your progress step by step, I created a post-op shoulder journal. That makes it simple. Click the link below to get your free shoulder pre-op checklist. We'll see you next time.